Asthma is a lung disease that inflames and narrows your airways. It makes breathing difficult. Asthma affects more than 300 million people around the world. It often begins in childhood but also affects adults. To understand asthma, it's necessary to understand a little about what happens when you breathe. Normally, with every breath you take, air goes through nose or mouth, down into your throat and into your airways, eventually making it to your lungs. Asthma symptoms occur when the lining of your airways swells and the muscles around them tighten. Mucus then fills the airways, further reducing the amount of air that can pass through. These conditions can then bring on an asthma attack, which is the coughing and tightness in the chest that's typical of asthma. The most common symptom of asthma is wheezing. This is a squealing or whistling sound that occurs when you breathe. Other asthma symptoms may include coughing, especially at night, when laughing, or during exercise. Tightness in the chest. Shortness of breath. Difficulty talking. Fatigue. Chest pain. Trouble sleeping. Causes of asthma. No single cause has been identified for asthma. Instead, researchers believe it's caused by a variety of factors. These factors include genetics. If a parent or sibling has asthma, you're more likely to develop it. Environmental factors. Air pollution, both at one's home and outdoors, can affect the development and triggers of asthma. Some allergens inside the house include mold, dust. Different illnesses, viruses, or infections can be a factor in adult-onset asthma. Animal hair and dander. Smoking and fatty foods trigger the asthma. What can trigger asthma? Triggers mean the conditions that aggravate or usher in an asthma attack. The most common asthma triggers include allergies, pollen, mold, dust, pets, and cockroaches. The environment. Smoke, air pollution, dry and cold air, weather changes. Infections like viral infections, pneumonia, sinus infections trigger asthma. Exercise can sometimes trigger asthma. Strong emotions, like anger, fear, stress, and excitement, can trigger your asthma. So can emotional responses, like laughing and crying. This is because your body's response to different emotions changes the way that you breathe. When you're feeling emotional, you might start to take fast and deep breaths. Understanding what type of asthma you have can result in better treatment and quality of life. Allergic asthma. Allergens trigger this common type of asthma. These might include mold, pollen, dust, pet dander from animals like cats and dogs. Allergic asthma is often seasonal because it goes hand in hand with seasonal allergies. Non-allergic asthma. Irritants in the air not related to allergies trigger this type of asthma. These irritants might include cigarette smoke, cold air fresheners, household cleaning products, perfumes. Occupational asthma. Occupational asthma occurs as a result of exposure to an allergen or irritant present in the workplace. About 1 in 6 adult-onset cases of asthma start at work. Additionally, about 21% of working adults living with asthma have found that their symptoms worsen at work. Both indoor and outdoor work environments can expose an individual to asthma triggers. Adult-onset asthma. Asthma can develop at any age, including during adulthood. Some factors that affect the risk of developing asthma in adulthood include respiratory illness, allergies and exposure to allergens, hormonal factors, obesity, stress, smoking, exercise-induced bronchoconstriction. Exercise-induced bronchoconstriction usually affects people within a few minutes of starting exercise and up to 10 to 15 minutes after physical activity. This condition was previously known as exercise-induced asthma. Up to 90% of people with asthma also experience IBS, but not everyone with IBS will have other types of asthma. Classification based upon severity. Asthma classifications include intermittent. Most people have this type of asthma, which doesn't interfere with daily activities. Symptoms are mild, lasting fewer than 2 days per week or 2 nights per month. Mild persistent. The symptoms occur more than twice a week, but not daily, and up to 4 nights per month. Moderate persistent. The symptoms occur daily and at least 1 night every week, but not nightly. They may limit some daily activities. Severe persistent. The symptoms occur several times every day and most nights. Daily activities are extremely limited. There's currently no cure for asthma, but treatment can help control the symptoms so you're able to live a normal, active life. Treatment includes reduce exposure to allergens, stay indoors on dry, windy days, avoid lawn mowing, weed pulling, and other gardening chores that stir up allergens. Remove clothes you've worn outside and shower to rinse pollen from your skin and hair. Don't hang laundry outside, pollen can stick to sheets and towels. Physical activity can be more difficult when you have asthma. But in fact, regularly getting your heart rate up through exercise can actually improve your asthma symptoms by improving your lung function, helping you control your asthma. Maintain a healthy weight. If you're overweight, it can make breathing harder. If you're underweight, your breathing muscles will be weaker and your body will have less strength to complete daily activities and fight off infections. So it's important to stay a healthy weight. Quit smoking and avoid secondhand smoke. Asthma medications. Inhalation corticosteroids are cortisone-like medicines. They are used to help prevent the symptoms of asthma. When used regularly every day, inhalation corticosteroids decrease the number and severity of asthma attacks. However, they will not relieve an asthma attack that has already started. Leukotriene modifiers, also called leukotriene receptor antagonists, are a group of medications. They can help prevent breathing problems associated with allergies, asthma, and chronic obstructive pulmonary disease. Long-acting bronchodilator inhalers relax the muscles around your airways to help keep your airways open. They're called long-acting because the effect lasts at least 12 hours. This is different to the short-acting bronchodilator in your reliever inhaler, which lasts only 4 hours. Combination asthma inhalers are used for the long-term control of asthma symptoms. They combine 2 different inhaled medications, a corticosteroid and a long-acting beta agonist. Theophylline is used to prevent and treat wheezing, shortness of breath, and chest tightness caused by asthma, chronic bronchitis, emphysema, and other lung diseases. It relaxes and opens air passages in the lungs, making it easier to breathe. It is possible to treat stress-induced asthma and to reduce its cause. People can keep a quick-acting inhaler with them at all times to relieve symptoms. It is also possible to learn to manage and relieve stress. There are many acupoints that may be used to treat asthma symptoms. Acupuncture is effective in symptom and quality of life improvement of chronic asthma. Hand acupressure points for asthma. Acupressure points lung 9 and lung 10 can help relieve respiratory symptoms such as coughing, wheezing, and shortness of breath. Rub 30 to 90 seconds at each point, then switch hands. Lung 7. This point is used to treat anything related to the lungs: asthma, wheezing, bronchitis, cough, congestion, etc. Lung reflexes for asthma. Massage this point 30 to 40 seconds to aid breathing. Repeat this exercise at least thrice in one sitting. Thanks for watching. Please like and subscribe my channel and click the bell icon to get new video updates.